the two countries really need to learn the lessons from the pandemic. Like we talked about the importance of the communication and the narratives matter. You cannot just speak anything, blame the other side. We have a lot of this kind of exchange of verbal attacks to each other. It's so negative that have a lot of impacts, not even just between the two countries, but also internally.
Hello, my name is Maggie Lewis. I'm an Associate Dean and Professor of Law at Seton Hall University. On behalf of the National Committee on U.S. China Relations, I'm pleased to have a conversation today with three of my co-contributors to the book, COVID-19 and U.S. China Relations. Before I forget, I want to let everyone know that it is available as an open access book, which means you can read it for free. Joining me are Yanzhong Huang, Senior Fellow at the Council on Foreign Relations and Professor at Seton Hall University, Joan Kaufman, who is the Senior Director for Academic Programs for the Schwarzman Scholars and a lecturer on global health and social medicine at Harvard Medical School, and Zheng Wang, who's the Director of the Center for Peace and Conflict Studies and a professor at Seton Hall University. Welcome, friends. So I want to start by turning to Zheng and asking about the origin story of this book. I mean, what prompted it, other than, of course, there was a pandemic, but what was the motivation to create the book, and sort of how did the process play out to put it together?
Thank you, Maggie. Thank you. It's a long story. For any book, I believe it's a long story. But after the pandemic, especially over the 1 year of it, we have all witnessed these consequences and the damage caused by the pandemic. It's not only just a public health issue; it becomes political issues. It's especially greatly affected the U.S. China relations. So, like in my introduction chapter, I mentioned to some extent this pandemic mirrored a kind of like warlike experience between the two countries in terms of like the separation, the information warfare, the disruptions, and also the fair resentment, the stimulation of nationalism in many ways. So I think this is because I'm a scholar, study nationalism, study peace and conflict. So I think this is really important for us to conduct research on it. I actually worked with Robert Daly of the Wilson Center, Zhu Feng of the Nanjing University. So three of us, we organized over 15 online workshops during the first year of the pandemic. And, I hate anything about the pandemic, but this is kind of like a silver lining for me is that during the pandemic, scholars from the two countries, we can organize the meetings and everybody is available because of the pandemic, especially our Chinese colleagues, in the first several months, they're locked down at home. And so we can conduct a lot of online discussions. We are talking quite several topics, not only just public health issues. We talked about the influence on the security issues, political issues, and so we engaged this kind of discussion. So at that time, we thought maybe it's a good idea that we could have a book and to have in-depth assessment of the damages caused by the pandemic to the bilateral relations. So this book basically is discussing about, I received the hard copy of the book, so it's basically about the COVID chapter of the U.S. China relations. So we had both Yanzhong and June wrote about the public health aspects of the COVID on the U.S.-China relations. Maggie wrote excellent chapter on the people-to-people exchange and the scholars exchange and education during the pandemic. Our other contributors, they wrote chapters on nationalism, anti-Asian sentiment in the U.S., and also how the pandemic affected the strategic assessment the country towards each other. So I'm quite happy about the final publication of the book, especially because of the support of the Henry Luce Foundation, this book can be available for open access.
And an edited academic volume that happens on time without a lot of road bumps is not the norm. So,
Yeah.
thank you for your guidance as we did this. But I want to turn to Joan because you were working on public health far before we had COVID-19 in our vocabulary. In fact, your work goes back some 40 years as a researcher, a funder, a consultant for the UN. But in all these roles, you were working with in some capacity with the Chinese government. So as we look back, not just to the pandemic time, but before that, sort of what takeaways do you see that we should really have in mind as we go forward with public health collaboration with China and the US?
Yeah, well, thank you, Maggie, and thank you very much, Jung, for organizing the book and including us all in there. As you said, I have been working on China for 40 some odd years since I joined the UN original team of the UN in China in 1980. And I've had a lot of academic and collaborations with the government. And I have to say, public health was not a particularly sensitive topic over all those years. It was an area because health is really a global public good, and I'm squarely on the medical and health side of the equation, not the politics side. The collaborations we did on reproductive health, on HIV/AIDS, and on emerging infectious diseases pre-COVID were smooth and collaborative with very much of a shared mission. To see the situation we're in now, where health has become very politicized, is hard to see because, as I said, health is a global public good. And I think for much of my academic and government collaborations, it's really been with a shared mission about improving a social justice issue for the world. I think some of the takeaways for me is that it's really important to not politicize public health issues. Of course, we're not in that point right now where SARS has strictly politicized it, but also I see that the science side of science and technology collaboration has become so caught up in the discussions on military civil fusion and the dual use technologies that the actual pure scientific collaborations that are aimed at global public good are sort of the baby that's gotten thrown out with the bathwater. They're collateral damage. There are lots of people like me that have worked in China over 40, 50 years on academic collaborations, on viral sharing, on many, many important aspects of the public health collaboration that, I think are suffering right now because there's been such a freeze and suspicion of any type of collaborative work with China in the science realm. So, I think it's important to really isolate it, insulate the public health work from the geopolitical tension. It's not about military, it's not about security issues, and try to limit that collateral damage. And I also think that the lessons learned is that being on the ground, presence on the ground, setting up these global collaborative initiatives like virus sample sharing through the global influenza virus sharing initiatives, these things really benefit the world. And we're in a much worse place if we don't have that kind of sharing to prevent the next pandemic. We need to be looking at animal health. For example, the One Health agenda, looking at not only human virus sampling, but animal virus sampling. We're in the middle of an H1N5, a bird flu pandemic right now that's now spread to mammals. Everybody's looking at it. Viruses don't respect national boundaries. So we need to be looking carefully at what's good for the world, what's good for us, what's good for both countries, and depoliticize it, really think about some of the good collaborations of the past. And I think there's been an enormous, just to add, amazing sort of sharing of joint training over the years that have had tremendous global benefit. Our CDC trained the China Field Epidemiology Training Program, our Epidemic Intelligence Service at the CDC, which is the leading sort of viral sleuths in the world who go, to places where there are emerging epidemics and figure out how to contain it and prevent viral spread. We've trained 20 cohorts of Chinese epidemiologists. They're out there. They were on the front lines of the Ebola response there. We have the capacity building through our collaborative efforts. The Fogarty training program at the NIH have created such capacity in China at this point and for the world from our two scientific powerhouses, China and the US. We should look at all these things. The early study that we did on folate and CDC study on folate and neural tube defects in northeastern China at the early days of of scientific collaboration between our two countries has changed protocols for the world that have prevented neural tube defects in children worldwide. So, the collaboration, this continuing collaboration is really important, and it needs to be depoliticized.
Yeah, and just so many layers of issues that you can pull apart, from, as you said, from children's health to emerging pandemics. But to depoliticize, one thing we have to get past or try to get past is the origins probe. And so Yanzhong, I mean, that was one of the, kind of the political third rail of this, and for the US as well as for some other countries too. So can you bring us up to date? Are we past that as a political obstacle, or are we still really living with it as a barrier to moving forward with health cooperation?
Thank you, Maggie. Unfortunately, the answer is no. That is still a issue that is hindering U.S.-China cooperation over science and technology, and also people-to-people exchange, because politicians are basically making this sort of like a prerequisite for improving U.S.-China, the scientific exchange. So, as Joan was talking about the need to desecuritize, to depoliticize, but unfortunately, right, we saw this over this issue of the origins probe, which should be a scientific undertaking. Unfortunately, has been heavily politicized, being framed as a national security issue, and dramatically affected U.S.-China relations in some very key aspects, right? So first, the issue has deepened the mutual distrust between the U.S. and China, because the debate here is whether this is caused by natural spillover or a lab leak. So, this issue has significantly undermined the trust between the two nations, and in a way, become a major contention point in bilateral relations, diplomatic exchanges, because both sides have, finger point at each other by spreading misinformation, disinformation, obfuscating facts, that leads sort of like a cycle. Second, it exacerbated the geopolitical tensions, right? Because the debate become intertwined with the broader strategic context, right? Each side view the other's actions through the lens of geopolitical competition, national security, rather than the scientific inquiry. The third problem is that it fueled these conspiracy theories, right? This is because, but in part because this lack of transparency, this politicization of the issue, actually led to the proliferation of conspiracy theories in both countries. In China, believe the American military, brought the virus to China. The U.S. believe that it's caused by a lab leak accident. Some even said it could be a biological weapons program. So this only further damaged the public perception, and it continued to affect the negative views of each other, among the general public in both countries, Because you look at the surveys, they show high levels of these unfavorable opinions on both sides that unfortunately also fuel this sentiment, calling for decoupling. And finally, what I think what Joan was mentioning, how it hindered by scientific cooperation, the U.S. Congress basically has made China's cooperation on the origins probe prerequisite for collaboration in public health and other areas. Limited the potential for cooperation. And we have seen how this recent this approval of the Biosecure Act in the U.S. House of Representatives, the example. How the controversy has led to the suspension of research, collaboration between U.S. and Chinese institutions and labs, that potentially also impact the future scientific partnerships, right? It also has negative implications on people-to-people exchange. Zheng was talking about during the pandemic, he had organized 12 online discussions between Chinese and U.S. scholars. I think this has become even more difficult in the post-pandemic era. If you ask for doing online discussions with the Chinese counterparts, they need also nowadays need approval. So it just shows the example, right? It's the Origins probe has become a significant flashpoint in U.S. China relations.
Also thinking we're pulling in some other threads from different parts of the book. And so in a minute, I want to turn back to Zheng to maybe pull in some of the recommendations from the, I think, 7 authors who are not with us. But just briefly back to Joan, one thing too is that about a month ago, the National Committee held one of these similar online conversations about the U.S. China Science and Technology Agreement, which has been so critical for collaboration and keeps being extended, but we're afraid it's going to fall apart because of political reasons. Can you give us just a quick update on where that stands and why it is so important?
Yeah, well, I think there are discussions ongoing to try to extend it. I don't think it's dead. But there's so much partisan resistance to re-engaging with China on science and technology, largely, I think, because of this, the dual-use technology fears, especially reservations about data sharing, about genomics, and about quantum computing, AI, synthetic biology, and those areas where the suspicions surrounding China and its motives these days, I think, have impeded the ability to, as I said earlier, throw out the baby with the bathwater and really be able to focus on those parts of the agreement where there isn't a lot of controversy about the benefits of the partnership. Frankly, I would say if you look at the history of the partnership, since it was signed shortly after normalization, right? And then really beefed up after 2003, after the SARS pandemic, there's been so much positive collaborative research that has happened, and it's provided a superstructure for many, many types of collaboration. I fear that without it, that stuff it's going to be very hard to maintain even the stuff that's commonly agreed upon. But I do think the stumbling blocks, of course, whatever happens in the election is going to have a large bearing on whether it goes forward or not. Suspicion of institutions, suspicions of the WHO, things like that, I think are stumbling blocks to really being able to move forward, even on things like the pandemic treaty, which, is, it's now the negotiations on that are extended. But it's been a hard negotiation to get a global agreement on how are we going to prevent the next pandemic, actually. More progress on the international health regulations, but these are kind of the main instruments we have globally for preparing for the next pandemic and for dealing with public health emergencies globally, which do not respect national borders. So, I'm hopeful that we'll be able to come to some version of a continuation of the science and technology agreement, especially in the mutually agreed upon areas like public health, clean energy. The clean energy discussions have continued. I think John Podesta was just in Beijing as I was leaving, continuing the very good collaboration that John Kerry had started with his Chinese counterpart. That continues, and I think some pieces of it have sort of stayed a little bit under the radar screen and are continuing. But without the overarching agreement, I think it's going to make it, I think we risk falling into what Yanjung has described as, the mutual suspicion, the everything focusing on, needing to have the investigation of the COVID origins as the starting place for anything else that happens, which, we don't really want that as a global community. The next pandemic is not going to wait for that investigation to conclude. And we already, we have there are lots of zoonotic spillover happening all over the place and on a continual basis. And I think many people in the public health community believe it's not if, it's just when do we have the next one. And we want to have the
Yeah.
capacity on the ground, the people, the CDC people, the people at the embassy, which has been built up a bit since the worst moments. There is, I think, an effort to reconnect and put more personnel back in China on the US side. But we want to have those people in place to be able to do joint investigations and early warning systems, right? So that we don't have another pandemic, which partly resulted from, the drawdown in staff and the inability to really do the early warning that was necessary to prevent the global spread. So
Yeah, yeah. And just, with this book, one thing was really trying to give concrete recommendations for how to move forward. And as I said, there was a number of other authors. So, Zhang, if you could maybe just pull in a few of the key takeaways that you thought were particularly important or innovative that you want to highlight here.
Sure. Yeah. When we design this book, we, of course, we ask each chapter focus on providing some assessment of the direct impacts of the COVID on the bilateral relations. But we also ask each chapter the authors to trying to provide some concrete proposals, suggestions for post-pandemic relationship. So I mentioned earlier, to some extent, this pandemic is like a warlike experience between the two countries. So after that, we should have talking about what we can do to have some kind of reconciliation. Actually, each chapter provides some suggestions. And so, for example, that I think one of the very important lesson we can learn from this pandemic is this bilateral relationship actually need a lot of communication from both sides to take care of it. There's a lot of issues need discussions, negotiation, communication at the different levels. So I think we mentioned, I also trying to summarize some of the recommendations from the authors. For example, like our chapters mentioned about these two countries should resume some collaborations on the critical areas, like the climate change, like the public health. Zhong and Yanzhong already mentioned nuclear arms control. These issues, people always compare the U.S. China relations like a relationship of marriage or couple. And if they decided to divorce, but at least they should realize they have some common responsibilities to take care, especially in these several key areas, to resume this kind of communication. But it's good, I think, that I think after the pandemic, we can say they have resumed some of this kind of discussions on these areas. And also, it's actually based on, Maggie, based on your chapter on people exchange that I also mentioned in the afterwards of this book that maybe these two countries should establish a joint task force or joint committee to help the scholars from the policy community to facilitate the visas and the visits to each other. Because this book highlighted that the importance of face-to-face communication between the two countries, especially between the policy communities. This actually a very important legacy of this bilateral relationship. In the past decades, the policy community can keep very frequent visits to each other. Now, people have different kind of concerns on this issue. How about we have a joint committee to help the scholars to get their visa and also to make sure that all the screen things that can happen before the visa rather than after. And they will not be harassed at the airport. Make sure that people not have the fear to visit each other's countries. So this is also one of the recommendations mentioned in this book.
And certainly, what better platform to talk about people-to-people relations and the importance of it than the National Committee? And Zoom is great, but it can only take us so far in communicating. And this isn't just about U.S. China relations. I'm right now in Prague. I have the checkbooks behind me to prove it. But anywhere you go, it is different when you actually sit around a table, have a meal together, and communicate in a way that isn't just through computers. But as you mentioned, Jung, one of the challenges, and this is bi-directional, is risks involved. So the health risks have gone down. And of course, there's still COVID, there's flu, there's plenty of viruses, but we don't have to deal with quarantine anymore, of those huge obstacles. Flights are still expensive, but there is this concern that is real, that both directions, that just because you have a visa, that isn't the same as what's going to happen when you encounter Customs and Border Protection, or you encounter the similar authorities in China, who do have a distinct job from the visa granting authorities. So they should serve a role at that point of entry, but how to make it so we can at least mitigate risk and make it so that we can regularize, really routinize the exchanges. So I don't know if Joan or Yanjong, are you seeing can you bring some optimism to this, that we're seeing an uptick in the flow of students and scholars and think tankers? And if not, or even if so, what more can we do to add some more gas into that tank?
Yeah, I mean, I'll just start by saying I think that it's going to be very hard to recover from the COVID era. I mean, just looking at students, for example, while there were, probably 11,000 or more U.S. students in China pre-pandemic, I think we've barely hit 1,000, of students that have returned. A lot of programs have moved elsewhere, and the level 3 travel advisory, I think, has given people pause. So, it's hard. I think we've also seen an exodus of talent from the United States. Yashang Huang, who was on the previous podcast on the Science and Technology Agreement, has spent a lot of time looking at this issue of the exodus of Chinese talent, from science talent from the United States, because of the environment here, which is so suspicious. So I think it's going to be very hard to recover. I do think we need to rebuild trust in institutions on science and collaborations. I mean, I've been to China 5 or 6 times now since the pandemic. Restrictions were lifted, and it's so normal, to just be together with your colleagues, your academic colleagues, talk about the issues that you work on. And I do think on the people-to-people side, it's, it exists. There's a continuing will and interest in collaborating. But the constraints that are around travel to China, suspicion about working in China, have made it much more difficult to get back to a place of trust and collaboration. So I'm not that optimistic, really. I think some things will, some important collaborations do continue, and that's important.
Yeah. Well, I share Joan's assessment of the current situation, that there's indeed but the desire on cooperation, right, from both sides, scientists, scholars, students, right. As far as public health is concerned, I noticed there's working level, collaboration sort of still in a way continued. But and actually, tomorrow I'm going to travel to Washington. There's the Chinese delegation led by the vice health minister is visiting. Is going to meet with them. But in the meantime, there's also, right, this sort of, I feel like the sense of pessimism, right, this current state of affairs, because if you think about, right, in the wake of SARS, right, you have the U.S. Secretary Tommy Thompson immediately, right, flying to China, negotiating with his Chinese counterparts with the agreement, preparing for next epidemics outbreak. But now you have the Chinese vice health minister in town, but it looks like there's no government official is ready to meet with him because of the political concerns, because of the the election season, right? Nobody seems to want to be viewed as being kowtowing, right, to the Chinese government. this is the unfortunate, right? This is the what we are seeing, right? And so I do agree with John that we need to rebuild the trust maybe from the scratch now. We need to have the confidence building, but this is going to really need some heavy lifting work.
Jung, do you have any optimism to bring to this? I mean, I will say that having been someone who's, with Yasheng Huang, been very concerned about the exodus of STEM talent, and also do we have the talent flows into the country? And that's partially about visas. It's partially about people wondering if they will get to the United States and find a welcoming environment. But, my sort of, glimmer of optimism is that I do think that there is a better conversation within the US among the academics, both the people who know something about China and those that know about hydrogels and theoretical physics and whatnot, and the people who are in the government agencies that work on the big grants for the science, as well as like the Office of Science and Technology Policy and law enforcement. This is not an easy conversation. It's going to take time, but there are efforts to try to at least get the United States coming up with some better strategies. But I agree that until we get past election season, that is going to have to be something that is in a quiet voice, but perhaps maybe next year we can get some more momentum. We're almost out of time, but Jung, any final words as the person who led this project, and hopefully we'll be doing more books in the future on these issues?
Mm-hmm. Yeah, actually, I totally agree that we should do more books on the pandemic, on this topic. The publisher, they believe that our book is the first book treatment on this topic. But this actually, a lot of topics we should continue to discuss. And like you mentioned, this is the election year, and actually the policy community should speak loudly to let the people, the future leaders, to know that the two countries really need to learn the lessons from the pandemic. Like we talked about the importance of the communication, and the narratives matter. You cannot just speak anything, blame the other side. We have a lot of this kind of exchange of verbal attacks to each other. It's so negative that have a lot of impacts, not even just between the two countries, but also internally. So I think that learning the lessons is really important. I think I'm still pessimistic, but at least this bilateral relation, I think, is getting more stabilized compared with the pandemic time. So that is something we should continue. We should continue to take care of that. So I will, that's my I want to get. Yeah.
I'll take that nugget of semi-optimism, and I certainly have learned a lot from you all three and from our other co-authors, and thank you for sharing your thoughts and your words. I also want to make sure to thank the staff of the National Committee who have been working behind the scenes to make this and many other productions happen. And if you enjoyed this conversation, we hope you will return for future National Committee programs. Thank you.